Patient journey, what to expect, getting a leukemia diagnosis. The leukemia program at Princess Margaret is the largest of its kind in Canada and the second largest in North America. We provide care for patients with acute and chronic leukemia, as well as a number of other related blood disorders.
Hello, I'm Dr. Andre Shu. I'm the Director of Clinical Services for Malignant Hematology at the Princess Margaret Cancer Centre. The Malignant Hematology program at Princess Margaret is the largest in Canada. The Acute Leukemia program at Princess Margaret is by far the largest program in Canada and is amongst the top 3 in size in North America. We pride ourselves at providing exemplary, multidisciplinary leukemia care.
One of your healthcare providers has asked you to see us to provide an opinion about your blood because you might have a condition that could benefit from our expertise. There are many different types of leukemia and related blood disorders, which are treated very differently. This is one of 3 videos meant to provide you with a broad overview about what to expect at Princess Margaret. In this video, we will tell you where you need to go when you get to Princess Margaret, what to bring with you to your appointment, and introduce you to members of your healthcare team. Finally, we will tell you what you can expect at your first appointment. A referral to the leukemia program at Princess Margaret can be a stressful event for patients and their families.
Hi, my name is Nancy. I'm one of 3 specialized oncology nurses that work in the Rapid Assessment Clinic. Patients are often very anxious and sometimes very afraid to come here. We'd like to alleviate some of those fears right up front. There's a number of things that we can look at. Bring a friend. You need an extra pair of ears to hear what we're going to tell you. It's very difficult for you to take everything in one visit. If you have to bring your children, there is a magic castle available. If someone could babysit those children while you're here, that would be an advantage to you.
Our team is committed to providing you with excellent care and making you feel as comfortable as possible. Princess Margaret Cancer Centre has 2 main entrances. The entrance on Murray Street is wheelchair accessible.
It was actually my doctor who called me in the morning based on blood results that he did the day prior, and just said, look, you got to go down to PMH Hospital and go right to the Rapid Assessment Clinic, and they're going to be expecting you.
When you arrive at Princess Margaret, you will check in at the Rapid Assessment Clinic, which is located in the Philip S. Orsino Hematology Center on the 2nd floor. To prepare for your appointment, bring your OHIP card and the medications you are currently taking. You can either bring a list of your medications or the pills in their original labeled bottles. You are encouraged to come with a friend or family member to keep you company and give you support. You may bring a lunch or snacks, or you can buy food at the Cancer Centre. Your first appointment to the Cancer Centre involves many tests and may be a long day, lasting from 4 to 6 hours and sometimes longer depending on your needs. During your appointment, you will meet many healthcare providers, including doctors, nurses, nurse practitioners, social workers, dietitians, and pharmacists. Each has a very important role to play in your care and is committed to providing you with the best possible experience. Princess Margaret is a world-leading teaching hospital, so you may also be seen by trainees, such as medical residents, fellows, or nurse practitioner students. After checking in at the Rapid Assessment Clinic, you will be asked to fill out some paperwork. A nurse practitioner or another member of your healthcare team will do an initial assessment. This involves a thorough review of your medical and social history and a physical exam.
You go through the process of getting your blood work done. After they take the blood work, I met with Alex Duck, a few of the other assessment nurses and staff.
You may have many tests performed. This may include drawing blood to be tested in our labs, an electrocardiogram to evaluate the electrical system of your heart, or a low-dose CT scan of the chest. These tests are important to help us understand what type of condition you have and how best to treat it. You may also get more tests if necessary. One very important test you may get is a bone marrow aspirate and biopsy.
My name is Alex and I'm the nurse practitioner in the Rapid Assessment Clinic. You may have already had experience having a bone marrow biopsy. We often like to repeat this procedure in the Rapid Assessment Clinic. The reason for doing so is that we would like to have your bone marrow reviewed by one of our expert hematopathologists. These are physicians that are highly specialized in the diagnosis of blood disorders.
During your appointment, you may have to see the in-hospital dentist. Our dentists have a lot of experience with dental issues related to blood disorders. The dentist will check your mouth and teeth. Your mouth is a main area for potential infections, so it is important to have it carefully examined. There is no charge for this initial exam. The Princess Margaret Cancer Centre is one of the top 5 research institutes in the world. Doing research is how we develop better treatments for our patients. You may be asked to complete research surveys or take part in clinical trials.
Hi, I'm Dr. Aaron Schimmer. I'm the head of the Leukemia program at the Princess Margaret Cancer Centre. At various points in your trajectory in your stay at the Princess Margaret, you may be asked to participate in a number of lab-based or clinical research studies. We hope that you'll consider these opportunities, although participation in research is always voluntary.
If you do not want to take part in a research study, it will not change the quality of care you get from your team. We know this is a lot of information to take in. Here are some things to remember. Please bring your OHIP card. Bring a list of medications or your pills in their original labeled bottles. Bring a friend or family member for support. Your first appointment may be 4 to 6 hours long. You may get many tests. You may be asked to see the in-hospital dentist. We understand your time at the Princess Margaret Cancer Centre can be a stressful event for you and your family. Our team is here to support you throughout diagnosis and treatment. We encourage you to ask questions, and if you have any concerns, feel free to contact a member of our team.
If you can stay patient, outside of that, I felt that every nurse, every staff member, every doctor was very aligned in their desire to, help treat and ensure you're comfortable, taken care of, and cared for.